to drugs when they get into the body? How are they distributed? How are they inactivated? How long do they remain active? Things like that.
And you've not published in that area, and you're not an expert in that area. Fair?
That's correct.
And you are an expert forensic pathologist determining the cause of death.
Yes.
In fact, you've devoted your entire career to the field of forensic pathology and determining the cause of death. Is that accurate?
Yes.
Okay. You're not an expert on propofol and how it works through the body in a pharmacological sense, are you?
No.
You're not an expert on lorazepam and how it works through your body from a pharmacological sense, are you?
No.
Now, you were speaking about the therapeutic ranges or the therapeutic range of propofol, but in fact what you indicated was that death can occur anywhere from 1 to 17 micrograms per milliliter. Is that accurate?
Yes.
And 1 is certainly less than the levels we see in this case. True?
Yes.
Now, you're aware that both these lorazepam bottles that were presented to you by Mr. Flanagan, respectively People's 107 and 108, or excuse me, 107 and 187, are you aware that these were both prescribed by Dr. Conrad Murray?
I did not notice when they were up here.
Okay, well, let me show you. May I approach the witness, Your Honor? May. Showing you People's 107, the lorazepam 2 milligram prescription. Do you see the prescribing doctor on that pill bottle?
Yes.
Who is it?
That is Conrad Murray.
And on the back of that, it indicates a date, filled date of April 28, 2009?
Yes.
And this is the bottle then that was prescribed on April 28, 2009, so 2 months before his death, that originally had 30 pills and there's still 9.5 remaining. True?
Yes.
Let me show you People's 187. This empty, discarded lorazepam bottle. Who's the prescribing doctor in regard to that item?
The objection of the bottles having been discarded, Your Honor, was found in the bathroom.
The objection is sustained. Re-ask the question, please.
Regarding People's 187, this empty bottle with no lid of lorazepam, who is the prescribing doctor?
That is Conrad Murray.
And the fill date on that?
That would be 4209.
Almost 3 months prior to Michael Jackson's death? Little less than 3 months?
Yes.
And this also had an original quantity of 30?
Yes.
Now, Mr. Flanagan had asked you about a number of parent defense hypotheticals regarding if someone consumed lorazepam pills via self-administration, right?
Yes.
Now, if you were to assume that the benzodiazepines, the two separate, well, let me back up. I want you to assume for purposes of this hypothetical that, let's just assume for the sake of argument, that Conrad Murray was telling the truth in his interview. That he started the night by giving Michael Jackson a diazepam tablet. That throughout the night he gave two separate IV administrations of midazolam at 2 milligrams each. And throughout the night he also gave two separate lorazepam IV administrations of 2 milligrams each. And that he also gave 25 milligrams of propofol. In that scenario, and then additionally assuming that apparently he left the patient alone so he could swallow lorazepam pills, additionally left the patient alone so he could go to the restroom for 2 minutes, additionally that there's no monitoring equipment, there's no EKG machine, there's a pulse oximeter with no audible alarm, there's no capnography, there's no resuscitative equipment, there's no airway management equipment, and that he comes back into the room to find a deceased patient. In that scenario, where the standard of care provided by the doctor is as I described, isn't it your opinion that this would still be a homicide?
Objection, Your Honor, it's beyond his expertise.
The objection's overruled under 801.
Yes.
And with the same assumption of facts as relayed by Dr. Murray, but let's assume he didn't take lorazepam, but instead he self-administered propofol when Dr. Murray abandoned him in the room. Would you also be of the opinion that was still a homicide based on the gross negligence of Conrad Murray?
The court's going to impose its own objection as argumentative. Re-ask the question, please.
The same set of facts that I mentioned, but now instead of self-administration, as Mr. Flanagan was suggesting, of lorazepam, let's assume self-administration of propofol. Under those facts, where Dr. Murray then leaves his patient with apparently the drugs accessible and no monitoring equipment, etc., isn't it true you'd still deem it a homicide?
Objection. Your Honor, assumes facts, not evidence.
Overruled. Jurors will decide what facts are essential here and what they find to be true. 801. You may answer.
Yes.
Thank you. Nothing further.
Mr. Walgren? Thank you. Request examination. Mr. Flanagan?
There was an oxygen tank inspected on July 13th. Was it?
Yes, and I'm taking this from Dr. Calmey's consultation.
On July 13th, when it was inspected, was it open or closed, the valve?
I don't know. I personally did not do the inspection.
Okay. How long would it take an oxygen tank that was in use to empty?
That would depend on how far open you had the valve.
Well, if you were using it in a therapeutic amount of oxygen, would you expect it to empty in 2 weeks?
Yes, probably.
Now, Mr. Walgren's asking, you haven't published any articles on pharmacology, and you're not an expert on pharmacology. Does your occupation as a forensic examiner, forensic pathologist, require some knowledge of pharmacology?
It does require some knowledge.
I mean, when you make a determination that a certain drug is a causative factor in a death, you should know what the blood level of that drug means, shouldn't you?
Objection. It's indicating he knows what the blood level means.
Overruled. You may answer it.
Yes.
And when you make a determination that propofol is the cause of death, you should know what the levels of propofol are and what they mean, correct?
Yes.
And when you make a determination that lorazepam is also a cause of the death, you should know what lorazepam levels mean, shouldn't you?
Yes.
And in this case, you don't know that, do you?
Objection. This states the testimony.
Overruled. You may answer.
Well, I think my testimony was that I'm not sure how we got to these particular numbers that the toxicologists found. However, having found the numbers that we did, I believe that these levels are the cause of death.
The levels are the cause of death, 2.6 and 0.169?
Primarily the 2.6. That would be the propofol.
Well, the 0.169, in relationship to causing a person to be in a highly sedated state, the 0.169 is much higher than 2.6 in propofol, isn't it?
Objection, irrelevant comparison.
Do you understand the question?
No.
Sustained.
Do you know that, well, you reviewed Schaefer's report, and Schaefer's report indicates a 0.19 level of lorazepam would put the person unresponsive to painful stimulus. You recall reading that?
Yes.
And we got a guy here, it's 0.169, which is about one pill beyond anesthetic for major surgery, lorazepam. Isn't that correct?
I'm not familiar with the use of lorazepam for major surgery.
Are you familiar with lorazepam being at a level where the person is not responsive to painful stimulus?
Yes,
That level is 0.19, correct?
approximately, yes.
And if he wasn't responsible for painful stimulus, you could do anything to him you wanted, couldn't you?
I'm not sure that's true. I don't know that lorazepam would give you sufficient anesthesia to do surgery.
Well, if you use the term unresponsive to painful stimulus, that means the person's not going to feel it when you stick a knife in them, doesn't it?
That's true.
Now, the lorazepam level in this case, on the other hand, was 2.6 micrograms per milliliter, and for that to be beyond unresponsive to painful stimulus, you got to go all the way up to 5.2, don't you?
Objection, that's the testimony. 2.6 related to propofol, not lorazepam.
I misstated. 2.6 level of propofol. That is not the level unresponsive to painful stimulus, is it?
That is correct.
According to Schaefer's report, you got to go to 5.2, don't you?
Something like that.
Twice the level. Double, correct?
Objection, he knows. I mean, I don't know that he has a report in front of him. I don't know.
Overruled, if you're able to answer.
So the question again is,
Okay, sustain the objection. Re-ask it, please.
Okay. In order to get to the unresponsive to painful stimulus level with propofol, you got to be about a 5.2, don't you?
that is according to Dr. Schaefer, yes.
And Dr. Schaefer's an anesthesiologist, correct?
Yes.
And that would be double the level that you found in the femoral vein. And Mr. Jackson, wouldn't it?
Yes.
Now, you were asked to assume that Dr. Murray was telling the truth with respect to a 10 milligram pill of Valium at 1 o'clock. Toxicology levels bear that out as being